Hey y'all, so Sarah Lawrence and myself, Lauren Flynn, have put together a short presentation of preeclampsia and most importantly the signs and symptoms that you're going to see associated with preeclampsia. So, just a little background knowledge, preeclampsia is essentially pregnancy-induced hypertension. It can be present sometimes after pregnancy, up to about 6 weeks, but most often preeclampsia resolves itself after the birth of the child. It can affect many different organs, and most often it's going to affect the liver and kidneys. It's most common in the second half of pregnancy and affects 1 out of every 12 pregnancies. If the preeclampsia is uncontrolled, it can lead to seizures, stroke, organ damage, and premature birth. So, some signs and symptoms of preeclampsia, signs that your patient will notice, maybe even before they come in and see you in the office, are going to be swelling in their hands and face. They might complain of headache, dizziness, or even visual changes, and these three are going to be a result of the cerebral edema, the swelling within their head that's pushing on the different structures of the brain. Also, upper right quadrant pain, and this is a result of liver damage from the compromised vascular system to the liver. So once you actually get them in the office and see them, diagnostically you're going to find that they have hypertension, and most often you're going to see that they also have proteinuria. Now, in the past, proteinuria was required for a diagnosis of preeclampsia, but recently that has actually been changed and it is no longer required, but is still very often seen with preeclampsia. So the three cardinal signs that providers typically see with preeclampsia are going to be that hypertension, so blood pressure's over 140/90, swelling in the hands and face, and proteinuria. All right, and so just something to remember, if you do have a patient that has been previously diagnosed with preeclampsia, or you suspect is going to be diagnosed with preeclampsia, it's very important to remember to regularly auscultate their heart and lungs, just because that fluid overload can negatively affect those organs, and you definitely don't want to be dealing with that. So, alright, that was our short little video. Hope you enjoyed it, and good luck on your test.